Hi, I'm Dr. Rob Myers, and this is Cardio Talks. I'm a cardiologist at Sunnybrook Hospital in Toronto. The goal of these videos is to explain common cardiac conditions in a way that is easy to understand. It isn't that complicated. It's usually doctors that make it more complicated. And so you go into my office or anybody's office, you're nervous. You're nervous because you have symptoms, or maybe you know what the diagnosis is. You've read things on the internet that have no context. When you're nervous, you don't really retain information very well. It goes in one ear and out the other. Plus, doctors are not exactly well trained in the skill of communication. Instead, we learn a completely new language, and then we use that language throughout our careers, and we lose sight of the fact that there's a lot of terms that patients just don't understand and nod their head anyway. So to understand the problem here, you have to understand how the heart works. The heart is just like the room in your house. It has muscle, which is like the walls. It has 4 valves, which are the doors of the house. It has a plumbing system, which is the red blood vessels you see on the surface. And it has an electrical system. All these things interact. The electrical system of the heart functions in a very specific way. You have at the top chamber of the heart a node of tissue called the SA node, and it's an electrical generator. So it generates an electrical impulse that spreads through the heart muscle and makes the heart beat. That's called electrical mechanical coupling. The other way to understand this is that it's like having a guard that's stationed at a bridge across a canyon. And the guard lets people go through in an orderly fashion. If the guard lets 60 people cross a bridge in a minute, your heart rate's 60, 90 people is 90. Now, heart rates are dynamic variables. They change all the time. It could be 40 in the middle of the night or 150 walking up a hill. It's the opposite of your height. If I check your height 1,000 times today, it's always going to be the same. With atrial fibrillation, the electrical system is basically damaged. So instead of an orderly progression of electrical impulses, the top chamber of the heart does that. It's like jello, quivering jello, fibrillates. It sends hundreds and hundreds of impulses toward that guard. And the guard doesn't know what to do. It lets some through. It can't let as many as are there, thank goodness. And it tends to be a fast and irregular rhythm. It's always irregular. It's usually fast. So instead of your heart starts to go. And it's the speed of the heart that people feel when they have symptoms from this condition, because not everybody has symptoms. It's not necessarily the irregularity. So if my heart rate now is 60, unlikely to feel it even if it's irregular. But if my heart rate's 130, I'm going to feel that. I'm not going to like it. And so it's the speed of the rate of the heart that usually results in symptoms. What causes atrial fibrillation? Short answer is anything. If I show you textbooks on every cardiac condition known, every single one of them can cause atrial fibrillation, which can be pretty annoying because sometimes we don't find a cause. And it makes sense. How many different ways can I mess with the electricity in this room? You name it, I can mess with the electricity. The heart functions in exactly the same way. The most common cardiac conditions would be the ones that are most often associated with this rhythm disturbance, and that'd be high blood pressure. So high blood pressure doesn't cause symptoms. And because it doesn't cause symptoms, people often don't get it treated properly. It's that classic line of, doc, I don't like medications. It's like some epiphany. Of course you don't like medications. Unless people are asking for Ativan or codeine, nobody wants medications. But in a nice way that is totally non-judgmental, I don't really care what you want. I'm an expert on what you need. So I'm going to explain things in an understandable way to a patient, and hopefully they trust me. They know I have their best interest at heart. I'm going to tell them what they need. If they say, I don't want it, well, that's on them, because my expertise is in what a person needs. They can determine what they want. It never starts with, what do you want? It's just not the way it goes. I don't negotiate with people. This is what you need. If you don't want it, totally up to you. I'm a libertarian cardiologist. And so high blood pressure, it causes stress on the heart. It's always beating a little harder. And over many, many years, that can mess up with the electrical system. Other common conditions. Anything that weakens the heart muscle, anything. And the most common cause would be a plumbing problem or a heart attack. So if your blood vessel blocks and you have a heart attack, you're going to end up with some weakness of the heart muscle. That can cause atrial fibrillation. Anything else can be genetics, can be chemotherapy, unfortunately. It can be a virus. Anything that weakens the heart muscle. So if your heart muscle is not totally strong, it can definitely result in atrial fibrillation. Any valve problem. So if you have a severely diseased valve, like a leaky or narrowed valve, and I don't mean mild, it's got to be severe, that can cause atrial fibrillation, can be very hard to manage. There are a bunch of non-cardiac conditions too. You could be admitted to hospital with pneumonia and have atrial fibrillation. People talk about thyroid disease. It's overblown. Hyperthyroidism that really is acutely bugging you, like you have all those symptoms, can cause it. I don't often see it. I certainly have. But if you just have a thyroid condition that's being managed and your thyroid blood tests are normal, that's not causing atrial fibrillation. Can be associated with sleep apnea, totally separate problem. And then there's alcohol and drugs. If you're a Coke addict, you're going to get atrial fibrillation more often, but also if you drink alcohol. Doesn't have to be binging and getting wasted, but it more often would be associated with that. There's a condition called holiday heart syndrome. Basically means you get wasted on a Friday night or Saturday night, you end up in the emerge. So every emergency department has somebody in their department on a Friday or Saturday night who drank too much and developed atrial fibrillation. Once you get it from any cause, it's hard to get rid of, and it tends to come back a lot. With alcohol, unfortunately, there have been recent studies that say even if you have a couple of glasses a week and you're predisposed, you can still get it. But again, I'm a libertarian doctor. I don't think people should be eating cauliflower and carrots, running on a treadmill so they can live to 100. You got to live your life. If every single time you have a glass of alcohol, you get atrial fibrillation, well, there's a message in there for you. You have to decide what you want to do with that. Our next video, we're going to talk about the symptoms of atrial fibrillation. I hope that helps.